The Vikings, a ruthless seafaring people, raiding defenseless villages, their hearts as cold as the steel weapons they brandished. You know what, though? Our modern understanding of Vikings is riddled with cultural cliches and stereotypes. What if these noble savages were just a bunch of misunderstood, fun loving Norse guys who enjoyed some harmless pillaging from time to time? Even the iciest heart can melt during springtime. Ah, yes, an early Nordic spring. Tulips popping up between snowbanks. It makes even the hardiest of men want to tiptoe through the fluoroquinolones. Flowers are the recurring sketchy symbol for fluoroquinolones, and notice that most of them are red. That's because, on an exam, remember that many of the important clinical indications for fluoroquinolones are for infections caused by gram-negatives, which is our red theme. Some fluoroquinolones have expanded gram-positive coverage, and we'll cover a few indications for these a little later. Fluoroquinolones work by inhibiting bacterial topoisomerases, such as DNA gyrase. DNA gyrase is an enzyme that relieves strain while double-strand DNA is being unwound. See how the long braided hair of the young Viking maiden kind of resembles a DNA helix being unwound? Well, think of this Nordic maid as a DNA gyrase who's relieving the strain of this double helix braid. Fluoroquinolones inhibit normal transcription and replication, killing the bacterium. Fluoroquinolones, therefore, are bactericidal. They have excellent activity against gram-negatives and are effective in treating numerous urinary tract and gastrointestinal pathogens. This UTI and GI bug coverage will be represented at this feast fit for a Viking. Notice that our gram-negative red flowers are concentrated here. Take a look again at our young Viking princess. She's holding our recurring sketchy symbol for UTI, our bladder-looking beverage. Many fluoroquinolones reach high urinary levels, and this symbol should remind you of those urinary tract bugs from Sketchy Micro, including gram-negatives like E. coli and Proteus. Uncomplicated UTI is usually treated with Bactrim, or a urinary agent such as phosphomycin or nitrofurantoin. Fluoroquinolones, however, are usually reserved for complicated UTI, such as infections in patients with a history of diabetes or urinary tract obstruction. We're going to highlight complicated UTI in two ways. First, take a look at our Viking maiden and notice that enigmatic smile, that certain lack of eyebrows. Look familiar? That's right, it's Mona Lisa, our recurring sketchy symbol for Pseudomonas coverage. Patients in hospital settings, especially those who are immunocompromised or have received urinary tract instrumentation, are at increased risk for UTI caused by Pseudomonas. Well, fluoroquinolones are your drug of choice, levo and ciprofloxacin specifically, and that's why we've made her elevating and sipping from the glass. Fluoroquinolones are often used for empiric treatment of uncomplicated and complicated pyelonephritis. To show this, we have another Viking drinking from his Nordic drinking flask, designed to kind of look like a pyelonephrotic kidney. It's draining something opaque and white to remind you of pyluria. Looks refreshing, though I'd definitely follow that up with a tall glass of levo or ciprofloxacin. Fluoroquinolones also penetrate prostatic tissue well, so they can be used to treat acute prostatitis in men. Right behind our Nordic Mona Lisa, we have a young Viking boy pulling the old tulip bulb down the skirt gag. Don't sit down, right on the prostate. The flower bulb is kind of supposed to resemble the shape of a prostate, socially awkward but memorable. From the urinary tract, we move on to the GI tract. See the various organs and intestines on the table, the perfect entree after a pleasant village raid. This intestine feast will represent fluoroquinolone's effectiveness in treating bacterial diarrhea caused by numerous gram-negative GI pathogens. This includes Shigella, Salmonella, E. coli, and Campylobacter. Remember that it's the red gram-negative flowers that are concentrated around the table. Let's highlight salmonella coverage by sketching in some freshly caught salmon. We'll cut away the meat on the front half and show the bones of the salmon. This is because fluoroquinolones penetrate well into bone, even with oral administration, so they are used to treat gram-negative osteomyelitis. Sickle cell patients specifically are at an increased risk of osteomyelitis, most commonly due to Salmonella species. That's why this Viking here is dining on the salmon with our recurring sketchy sickle. How delectable! Fluoroquinolones also have activity against some important gram-positives. Let's sketch in a few of them now, and notice the concentration of purple gram-positive flowers around these symbols. Bacillus anthracis, that spore-forming gram-positive rod that causes anthrax, is treated with fluoroquinolones. And just like in our sketchy micro-sketch, we have a Viking wielding a bloody anthrax axe, representing the resulting hemorrhagic and necrotizing pneumonia. Levofloxacin and moxifloxacin make up a group of fluoroquinolones with improved activity against gram-positives, particularly strep pneumo. This pneumonia-causing bug is always embodied in a rusty lung chest plate, and we have it incorporated into the armor of this coughing Viking who is hard at work docking the incoming ships. These so-called respiratory quinolones can also cover Haemophilus species, making these agents effective in treating community-acquired pneumonia. These fluoroquinolones also have activity against agents of atypical pneumonia, such as Mycoplasma and Legionella. So these respiratory quinolones are used to treat respiratory infections that are less defined on chest X-ray. We'll highlight these atypical respiratory pathogens here at the dock. Mycoplasma pneumonia is always represented as a walking pneumonia, and if it isn't our walking snowshoe guy from Sketchy Micro. When you hear mycoplasma, think my cold plasma, like this coughing, pneumonia-ridden Nordic snowshoer. The other atypical respiratory pathogen, Legionella, is represented by this legion of ships. No band of Vikings is complete without one. A few comments on drug administration. Fluoroquinolones are well absorbed when taken orally. This oral absorption, however, is impaired by divalent and trivalent cations, such as calcium, magnesium, and iron. Fluoroquinolones, just like oral tetracyclines, should be administered a few hours before or after ingesting milk, antacids, or iron supplements. These multivalent metals are going to be represented by these medals awaiting the victors of the Nordic Springtime Games. What, never heard of it? Well, little known fact, Vikings work hard and they play hard, especially when the hand of the land's most enigmatic maiden is at stake. The contest? Tug of war. Notice the pattern on the sheet they are pulling to represent an EKG, and it's getting pulled to remind you of the risk of prolonging the QT interval. It's an adverse effect also seen in macrolides. This long QT syndrome can lead to torsades, so we've drawn in the EKG strip with the characteristic twisting QRS complexes. Two more important adverse effects of fluoroquinolones will be represented at the dining table. First, the most common effects are nausea, vomiting, and diarrhea, as witnessed here, because Vikings work hard and they dine hard. 3. With a vengeance. This gluttonous Viking is suffering from classic nausea and diarrhea symptoms. And finally, in the back, we have our dining royal family. Notice what the king Viking is gnawing on. Kind of tendony, maybe even a little cartilagey. That's because fluoroquinolones can lead to tendon and cartilage damage. Important to keep in mind in certain populations. Let the king's old age and his outrageous but distinguished-looking beard represent the important risk factor for tendon rupture in elderly patients, and those on steroids, as represented here by the classic glucocorticoid-induced moon faces on his shield. Next to him, the queen is pregnant in order to represent the avoidance of quinolones during pregnancy. Notice the tarantula symbol for teratogen. The young prince should help you remember that fluoroquinolones are usually not recommended for children less than 10 years of age because of damage to growing cartilage, leading to arthropathy. And that's it. Let's sum up this sketch. Fluoroquinolones are used to treat gram-negative GI and UTI bugs, including Pseudomonas. They are usually reserved for more complicated UTI and empiric treatment of pyelonephritis. Remember that the table has a corresponding concentration of red gram-negative flowers. Fluoroquinolones work by inhibiting bacterial topoisomerases such as DNA gyrase. To the right, we have some purple gram-positive flowers concentrated around the bloody anthrax axe wielder. At the dock, we highlight respiratory fluoroquinolones. They're used to treat strep pneumo, but also atypicals such as Mycoplasma and Legionella, which can cause a less defined walking pneumonia. Don't co-administer fluoroquinolones with those pesky cations, and remember the important side effect that involves cartilage damage, tendon rupture, or arthropathy. This can be in elderly, especially if on steroids, the unborn fetus, and in children less than 10. You know what? I think we really broke through a few Viking stereotypes today. Vikings are people too, and they enjoy the same things we do. That old prostate gag. Classic.